All right, shall we get started? I know people are still filtering in, but this is a safe and pretty relaxed space. So I just want to say hi to everyone who's joined in. Thanks for being here. I'm Dr. Di for those of you whom I have not met yet. And I'm the health professions advisor at Beyond Barnard. And today I'm joined by my colleague, Claire. Claire, will you say hi?
Hi, yes, I'm Claire. I work with Dr. Di with logistical and practical pre-health advising things.
Yeah. So you may have heard from her by email and things like that. Claire's awesome, and she's going to be helping out today just to kind of like manage the flow of things. So I think what we'd envisioned was basically just to have a space for people to ask questions and kind of talk a little bit about what's on your mind. And so I'm happy to help as much as I possibly can and give all the answers that I have at this time. So if you have a question and you want to ask by opening your mic, that's great. If you want to ask via like the chat, you can also do that. And if Claire, please would keep an eye out for questions on the chat to alert us, that would be great. There's also a link to the sign-in sheet on the chat. And so if you would please just quickly sign in, first name, last name, and your uni. And that way we can capture everybody who attended today, which is really helpful for us. So do any of the NPMS folks have other remarks to get us started or thoughts as we get started?
I just want to say thank you everyone for coming. Very excited about this. And this is Dr. Di, and she's the best resource for pre-health related questions. So thank you everyone for coming, and feel free to ask questions.
Yeah.
Yeah, second what Eliana said.
All right, so any questions? Oh, Claire, could you resend the link? Thank you. Thank you. There you all go. All right, so any questions?
So Eliana posted one in the chat.
Yeah.
Oh, okay.
My question is, how is the college going to indicate that this semester was mandatory pass-fail and not opt-in for our med school applications like other?
Yeah. So if you've taken a look at your unofficial transcript in the past month or so, you may have already seen there's already a notation on the transcript that says, due to the COVID-19 pandemic, classes are mandatory pass-fail in this semester. And then additionally, for pre-health students who go through our committee process, we will include this year and in years forward, going forward, a note in the cover letter that goes with our committee letter. The cover letter provides a little bit of information just about the curriculum more generally. And so that's also a really great place for us to be able to note specifically the pass-fail semester for this spring. And that was obligatory. There was not, it's not an elective thing. So that's something that we'll also note in the cover letter.
Cool. Can I ask just a question about cover letters? What exactly do those entail, and like what does that process look like for some of us that are not so familiar with that?
So for those who are applying to medical or dental schools, Barnard has what we call a committee process, which is basically a process by which you can receive an institutional letter of evaluation. And that's a letter that basically provides some narrative about you as a person, some biographical details. And it also provides some specific context about you through a few lenses that are important to professional schools. So the things that we pay attention to most in the committee letter, the sections of the committee letter basically are first academics. So we talk a little bit about the academic choices a person made, why she chose her major or something of that nature. We can also talk a little bit about grades there. If there's particular information that's helpful to contextualize the grades, then that's something that we can bring to light in the committee letter. For instance, if somebody had an illness or serious personal issues in a semester and that created some problems with grades, we can provide that context, which is really helpful for students sometimes. We can also point to things like strong trends in grades or how difficult the curriculum that a person took was, all of those sorts of things. The next section is research and scholarly work. So we talk about any kind of research that a person has been involved with. That includes, of course, bench research, but that's not at all the limit of what we talk about. So if you're involved in social science or humanities research, clinical research, or really any kind of research, that's something we would bring to light there. We discuss clinical experiences that are relevant for a particular person. So that could be hospital-based, but they could be based in other contexts as well. We also have a section on service experiences, and that's not necessarily clinical in any way. You know, if you're involved in service through, say, an on-campus organization or a religious community or really anything, you know, tutoring or all sorts of different kinds of service. We can talk about that there. And then the last section is for anything else that's important to contextualize about that particular person. So maybe you're a person like me who was a first-gen student and you worked during your undergraduate career. We can make that clear in the last section of the letter. If you're a person who is not like me, super gifted artistically, and that's something that you do in your undergraduate years, that's something we can also talk about. So basically each of the letters is really customized for each person, and the sort of package that is eventually sent to professional schools includes an individual committee letter, our cover letter, which, as I said, kind of gives basic information about our curriculum. You know, Barnard's chemistry courses are not like a lot of other schools' chemistry courses, so we talk about that there. And then your individual letters of recommendation also get included with that package, and those are the things that we send to professional schools on the behalf of students.
Great, thank you.
Yeah.
I think another big question people have is what this summer is going to look like and how it's going to be interpreted by schools. So since like SRI and other research work and volunteering at hospitals is canceled, like what do you suggest we do this summer, and how is this summer going to be looked at considering those things are canceled?
Sure. I think it's good to keep in mind that professional schools are really impacted by all of this as well. So if you've kind of followed any of the news about medical education, for instance, there's been a lot of changes. A lot of schools have graduated students early. A lot of schools have pulled their students who are in internships out of the clinical setting because it wasn't safe for them to be there. So the thing that's really important to remember is that the global level of the effects here means that schools are really, really highly aware of the constraints that undergraduates currently are working with. And with that in mind, I think there's no expectation on the part of professional schools that students be in clinical environments right now. In fact, I think they would probably be a little worried if they saw that somebody was in a clinical environment at this moment. And really, they're, I think, going to understand that the kind of breadth of opportunities for pre-health students during the summer has significantly been reduced. You know, a lot of the things that we do, you know, kind of, or that you as pre-health students do, are things that you do have to be in person in a particular context to do. And so I think what they're going to be looking for ultimately is resourcefulness and responsiveness to the situation. So if you think about things that I talk about a lot are the competencies, the core competencies for entering medical students. And I think they're good competencies for everyone to keep in mind. And some of those competencies are things like adaptability and resilience. And so being able to sort of, demonstrate that in some way that's important to you, I think is a really good thing to be thinking about doing this semester, or this summer, sorry. And in specific terms, I've been thinking a lot about the ways in which this crisis, as scary as it is, it does present an opportunity for you to show support for others and to be there for others. I think it's been really heartwarming for me to see instances in my own communities of people really trying to, be there for each other. And so what I've been recommending that students think about are, what is the situation where you are? Are there ways that are kind of hyper local that you could potentially do service to help other people in your own community? Are there remote service opportunities that you could engage in that will allow you to do the kinds of things you're interested in, but in a safe way? And so thinking about things like, for instance, helplines or an organization like Crisis Text Line, which is a national organization, you can be trained to provide help to people who are having a really rough time right now. And Crisis Text Line and many other more sort of local hotlines have experienced a real influx of callers and texters lately because people are really going through it. So I think that's a wonderful way to use some time to get trained to help other people in a specific way. But certainly thinking about other opportunities as well. For those of you who enjoy tutoring, there are lots of online tutoring opportunities. As kids have been kind of forced out of schools, they're not getting the same kind of support that they would normally. And so, if you're interested in education, or especially access to education, that's a great thing to look into. And then looking within, local organizations. For those of you who are here in the New York City area, organizations like NYC Service, which is government sponsored, and New York Cares, which is a great organization, they provide opportunities for short and long-term volunteering, some remote, some in person, depending on your comfort level, and some are specific to the COVID-19 response. So I would say looking at agencies, near where you are to think about local things that you can do to make a difference right now is a great way to be developing aspects of your portfolio that are really important, even if they're not science-centered. Oh, and I would also say, sorry, one last thing on that. If you haven't seen yet, there is an event on Monday at 5 o'clock. I'm going to send this, Claire, I'm going to G-chat the link to you. Will you send it out to everybody? It's called Planning Your Summer in STEM. And for those of you who were planning to do SRI, it's definitely an event that can be helpful. Some of my colleagues at Beyond Barnard are going to be talking a little bit about things like internships and sort of other more science-centered things that are not necessarily pre-health specific, but if you're a science-oriented person, it could be a good event.
Great, thank you. I think we have a question in the chat.
Okay.
Or a couple.
Okay.
Unless whoever wrote it would like to. The first question is from Alex. I was thinking of taking Physics 1 and 2 at Columbia this summer, especially to graduate on time, but wanted to know what your advice is on this for thinking about med school admissions.
Sure, yeah. Summer coursework, especially with physics, is always a question, I think every summer, not just this one. But, this summer, I think a lot of people are seeing coursework as something productive that they can do with their time. I will say, my normal cautions about summer coursework are that it's tough to do when you're doing other things. And so, this summer, actually, that concern is taken away a little bit, right? If you don't have a lot else on your plate, then it's a lot more feasible, I think, to be successful in summer courses. The caution that I have for this year is a little bit different because, as all of you know, most universities are offering online courses this summer. And while many medical schools are open to accepting online courses during the pandemic, I would say it's not a uniform response. So there is the possibility, if you were to take an online summer course this year, that a medical school may not accept it for prerequisites. There is a list that the AAMC has produced. Let me actually go find it right now so I can share it with you. So the AAMC has been asking the medical schools to kind of provide updated information about all of their policies and procedures relating to admissions. Normally these are reports that are only for advisors, but they've unlocked all of them so that undergraduates can get a sense of all of this stuff. So this is the newest version. Claire, I'm going to chat it to you, and if you would chat it out to everyone. This is a resource that you can use to kind of take a look at what the stated policies are at schools that you may be interested now, to kind of get a sense of what the relative feeling at the programs you're interested in may be. And then of course you can also check individual programs, admissions websites to see what their kind of most currently updated policies are.
Okay, thank you. The next question. This is from, sorry, I'm going to butcher the name, Shaila. If you are taking a gap year after graduation, when are those cover letters written? When you graduate or when you are applying?
So the committee process is a process that you would go through in the academic year prior to when you apply to professional school. So you can participate in our committee process as a current student or as an alumna. There's no difference in the process whatsoever. And in fact, a lot of people who participate in our process are alumni. So our process, let's say you were planning to apply next year in June 2021, you would start the committee process in late fall 2020. So you'd be doing your preparation during the academic year for an application in summer 2021. And then we would, you would go through our process during the academic year, as I said, and then as you apply, your letter is finalized and uploaded to the services. So it's when you're actually applying that you'll go through the process. I hope that makes sense.
She says thank you.
All right, awesome.
So I actually have a question.
Okay.
How do I ask a teacher for a letter of recommendation for the semester? And am I allowed to ask them to indicate what my grade would have been if it wasn't mandatory pass-fail?
Sure. So I would say you want to keep in mind that you'll be, I mean, depending on kind of where you are in your academic career, the relative necessity of having a letter from this semester can be different, right? If you're a person who is, you know, graduating this year and maybe we're really hoping to show continued growth in your academics over the course of this last semester and aren't able to because of the pass-fail policy, potentially having a letter from an instructor makes sense as a way to kind of counter some of those concerns. But if you're somebody who is, say, a first or a second year student who has several semesters left, I wouldn't say it's imperative that you have a letter from this semester. It's certainly, I'm not saying it's a bad idea, but I'm saying don't feel pressured that you have to have a documentation from this semester because, you know, kind of regardless of the situation, admissions committees are going to evaluate applications holistically. And that means that they are really going to, they're going to look at the sum total of your academic experiences and not just focus on this one semester. If you are in, you know, in a place where you would like a professor from this semester to write for you, then I would say, you know, you want to reach out, maybe ask to schedule a conversation with that person. It can be easier to kind of talk these things out. Talk with them a little bit about your application plans and why you're asking them to write the letter for you. I think it's really helpful for anybody who's approached for a letter of recommendation to have a good sense of what the context is and kind of why the person sees them as a good fit for the application. And then, you know, in terms of the grade, it may or may not be possible for the instructor to kind of give you the equivalent of a grade for the semester. Certainly, I think they can speak to your overall performance in the course relative to other students. They can talk about, you know, the specifics of your academics, but because, you know, they're not expected to keep grades in the same way. Some professors are kind of not in a place where they can actually give that grade information. And I wouldn't say that that's the most important thing. I think, you know, getting a letter from a professor this semester is probably much more about, you know, someone who can speak to, you know, your adaptability to this situation and the way that you handled really adverse circumstances academically. Those are really important things. The grade itself may not be the most, I mean, typically in a letter of recommendation, the grade itself is actually not the most important thing. So it's always better, I think, to have a letter from someone who can say a lot about you than someone who can say you got an A in their course, basically.
Okay, thank you so much.
Yeah.
Does anyone have any other questions? If not, I've got a whole list I'm happy to ask.
Okay, keep going.
So my next question is about, now that a lot of our summer programs have been canceled, we're interviewing for new internships when we weren't necessarily expecting to. So this is just more about how do I stand out in a virtual interview, specifically in regards to something that if my whole resume is basically like health-related things, to stand out for something that's not normally what I would be doing in the summer.
Yeah, I mean, I think you want to think about what it was that drew you to apply to that particular internship. You know, thinking not necessarily in broad strokes about the experience, but really in terms of the specific details. You know, are there particular skills that you can bring to that experience from your background, even if it's, you know, from a different set of experiences or a different kind of industry. You know, if you're a person who's only ever done, you know, natural science research, but you've got a really great grasp on computer modeling and statistics, and that's something that you can bring into an internship in, you know, a social science sector, that's really great information. And I think that sort of, you know, ability to identify the specific skills is a central piece of, you know, being a liberal arts student. You're not necessarily being trained to do a thing, you're being trained to be adaptable, really. And so I think really focusing on what are the aspects of your past training that you think are applicable to that situation, as well as, you know, what are the aspects of that internship that make you excited? Like, what are the things that you're looking forward to learning, and being able to then in turn apply back to things that are more directly related to your career. I think that's also really helpful, because being able to demonstrate investment in an opportunity and kind of being able to articulate, you know, why you're actually interested in a particular opportunity is always really important in the interview process, even if it is something that kind of falls directly within your wheelhouse.
And then in regards to finding internships for this summer now, do internships need to be directly related to health at all, especially given the circumstances?
They never do. I mean, I think, you know, this is again a question of like, what are the fundamentals? You know, what are you learning in this experience that you can then apply to your studies, to your career, to whatever it is that you're doing in the future? What I often tell this anecdote, a couple of years ago was talking with some admissions deans, and someone asked them a question about, like, you know, what about people who have experiences that aren't related to medicine? You know, how do they present those, that sort of thing? And I remember really clearly that the dean of Tufts Medical School said, you know, I would put it to you that there's very little in this world that's not related to medicine. And I think that that's really true, because, you know, health professions at their core are about human beings. Of course, it's about science, but these are professions where you're learning to care for other people. And in order to be successful in those careers, you need to, of course, know the science, but you also need to know how to develop relationships with people, to communicate effectively, to think critically. And so really, you know, there are lots of different kinds of things that you could do with your time that are going to train you in, as I said before, those competencies that are really important for admission. You know, of the 15 of them, 2 have to do with your knowledge of sciences. Everything else you could really develop in so many different ways. And I really think that for somebody who, you know, is looking for something that could be interesting and productive, even if it doesn't seem, you know, directly related, I think the important thing is to really think about, like, how do you bring this into the narrative? You know, what do you take from this experience? What does this experience bring to you as an individual and to your application in the future? And there are lots of ways to conceive of that, I think. So I think that's, I think, a really central part of the application process as well. You know, even with your experiences that are, you know, in a hospital or in a lab, right, that are sort of very easily identifiable as pre-med type experiences, you still need to develop a narrative around those and explain kind of how they make sense for you as an individual. And so this is really good practice for that part of the process as well.
Okay, great. Thank you.
Mm-hmm.
Does anyone
Else have any questions? And feel free to put them in the chat if you don't want to talk out loud. Otherwise, I have a question. Okay, so no one else. Do you think that because of this summer, with like there being less opportunities for clinical and research internships, that it would be recommended by schools to take a year off after graduating from undergrad to add more to your application?
Well, I think that that's always going to be an individual decision. I will say it is very common for people to take a gap year, particularly at Barnard. Last year, almost 90% of our applicants were taking 1 or more gap years. This year, the number is slightly different, but it's still vast majority people who are taking at least 1 gap year. So it's very common. It's common nationwide too. It's not just a Barnard thing. And that's true for a variety of reasons. I think that, you know, the availability of internships over this summer could impact some people more than others. You know, for people who have been able to accrue lots of experiences during the academic year, then, you know, there may be less of a concern. If there's someone maybe who is coming later to pre-med or pre-dent or, you know, pre-health of any kind, and kind of is just getting started, then it may be a good idea to kind of plan for some additional time before application. But I think that that's always a decision that has to be the sum total of your preparation, you know, in terms of grades and metrics with test scores, as well as your kind of professional preparation with experiences. I do think, you know, certainly schools are going to understand if someone is not, you know, scheduled to the hilt this semester, right? Like, you may not have a 40-hour-a-week commitment, this summer. That just may not be as feasible as it would be in other times. And so I think, you know, planning to use your time effectively in whatever way that means to you is probably the most important thing. And then, you know, being cognizant of where you are and evaluating yourself at each step along the road is always important in deciding about application timing.
Thank you.
So I actually just have a random question to throw out there. How do I make myself stand out in med school applications? It's like the question I've been asking everyone.
Well, there's not an answer to that question. So you're not, there's no one answer to that question. You know, that's the tough question. And that's the question that kind of perennially comes up, you know. I hear this a lot from pre-health students, because a lot of people come to careers in medicine or other health professions from relatively similar motivations, right? The likelihood that, I mean, like, I could pretend to be a psychic, right? The likelihood that you are a person who's interested in science and in humanism, and like, you like solving puzzles, and you like, you know, being of service to other people. Those are all probably true of most students who are applying to health professions programs. And there's nothing wrong with that, right? Like, there's something very central and very, you know, real and specific about those kinds of motivations that I think are, you know, that it can be true and can be very, very meaningful and, you know, incredibly motivating for individuals. But because of that, I think that it's really important to consider, you know, as I said before, the way you present your own presentation and your application. So this is a long way of saying, right, like, when you look at 1,000 medical school applications, which I have done many times over, you will get a sense of some kinds of experiences that are very common across the whole population, right? The likelihood that this person has some clinical experiences, very high. The likelihood that this person has some research somewhere in their background, pretty high. The likelihood that there's service, yes. The coursework, there's a lot of overlap, right? And so it's not that, like, the facts of the application that makes someone stand out, but I think much more the way that they're presented. And so, you know, when I talk about things like starting to develop a narrative for yourself and to be able to express a specific perspective, that's really what I'm getting at, this question of uniqueness and the question of sort of standing out in the application process. When you are reading applications and you are hearing things, you know, sort of phrased in exactly the same way, and people, you know, not necessarily really like delving specifically into their experiences when they're describing them, it gets very, very samey. And then when you read an application where there's someone who has carefully reflected on what her experiences have meant to her, what they've taught her, what, you know, what she's taking into her career as a result of these experiences, that's where you get really excited, because this is a person who has been considering what all of these things mean, right? And so I think having this approach where it's not just like checking a list of things that you need to do, even though those things are common and the likelihood that you're going to do those things is high, but really thinking of how those experiences integrate to create your unique perspective, that's the key thing. You know, I think when you're writing about a clinical experience, recognizing lots of people have had experiences like this, right? And the experience is limited to some degree, right? Because you don't have training to be able to offer clinical care at this point. So you are restricted in what you can do. But that doesn't necessarily mean that you can't keep your eyes and ears open and observe in that environment and really learn from both the patients and the practitioners that you're engaging with. And then when you come to write about it and really present your experiences through your own eyes, that's where the kind of unique standout stuff comes into play.
And how would I do that? Sorry, thank you. How would I do that with specifically this semester and this summer when discussing, I guess, what I've done in relation to the summer, in relation to COVID, everything like that?
Yeah, I mean, of course, it'll depend on the specifics of the experience, but say imagining you're a person who maybe engages in some service experience within your own community that you may not have done. Maybe you wouldn't have been home at all during this summer if it weren't for this. So this is, you know, something that you weren't necessarily expecting to have be part of your portfolio. But I think, you know, let's say you're involved in a service activity and you reflect on what it is that brought you to this experience, right? You know, I think it's okay to acknowledge this is, you know, something that was unexpected. And I, you know, in response to this very serious public health crisis, wanted to be able to do something within my power, basically, to help, you know, to provide some kind of solace for other people or something along those lines, right? And I think really kind of reflect on the circumstances that brought you to the experience, but then, you know, what you're taking away from it. I think demonstrating, you know, that this is something unexpected is helpful in acknowledging, you know, you do have to be able to be resilient and you do have to be able to adapt to unexpected circumstances. These are, you know, everybody has to do that in their career, and it's definitely important for healthcare professionals. And so I think, you know, doing what you can to express the perspective that you've gained from the experience, kind of recognizing, you know, maybe I didn't get to do the things that I was planning to do and things I was really excited about doing, but that's because there are things in the world that are kind of like more important than me as an individual, right? And so I think recognizing our interconnectedness as human beings and as a society, and what our individual responsibility is in terms of confronting an issue like this that none of us have really dealt with in our lifetimes. I think that is a really good way to start thinking about presenting these kinds of things. It's okay to acknowledge that it's tough, you know. The expectation is never that, you know, things are always easy for you as a person. The expectation is just that you are able to kind of learn and grow from these tough experiences.
Okay, thank you. Does anyone have any other questions? Feel free to write it in the chat. Not? Okay. I think I'm good with questions, so maybe we can wrap up.
All right. If there's, well, I'll hang around for a second if there's any more. Anybody, don't be shy. Like, you know, it's fine. And do check out the links that we shared in the chat. Please make sure to sign in if you haven't done so already. If you are thinking about, you know, internship searching and all that sort of stuff in the STEM area for the summer, please do join in Beyond Barnard at 5 o'clock on Monday, this coming Monday the 11th, to just talk a little bit with some of my colleagues about ideas. So AJ will be there, my colleague Jen, who works in fellowships advising and works with the SRI team, as well as my colleague Brianna and my colleague Christine, who really knows everything, I think. She's unofficially my mentor. She doesn't know that, but so they're really great people, and they're going to have some ideas, you know, about sort of STEM specific things. But you know, as you are going through the summer, remember this is super, super hard, and it is unimaginably difficult. I've said to a lot of people, if I were in your shoes, I would be at home with 3 siblings and like terrible internet and nothing to do because I'm from the middle of nowhere. So I sympathize deeply, and I know that it's a tough situation for all of us, but I hope that you all stay safe and healthy, and your families as well. And remember that this is one piece of your preparation, and this summer, while a chance to, you know, show some resilience, show adaptability, and to show care for your communities, is not going to derail the rest of your life. It's tough, but we are going to get through it. And if you have questions, you're scared to ask them here, you can always email me, and I'm happy to chat individually as well. Okay, I'll be around during the summer, and you can make appointments via handshake as usual for phone or video appointments for the foreseeable future.
Great, thank you. Thank you so much.
Yeah.
Thank you.
And
All
thank
right.
you
Thanks
very
everybody
much.
for being here. I'll see you all. Take care.